what is codependence and how does it impact relationships? Codependency in relationships is something that clinicians and therapists see all the time, identify it all the time, we call it out all the time, and often we say it like it's a very familiar or easy to understand concept. But for those that are not trained mental health professionals, it can be a little confusing. So I'm going to take a few moments to explain codependency and also give you 5 signs that you may be participating in this type of toxic relationship pattern. So, what is it? Basically, codependence is a dysfunctional pattern of behavior and thinking that develops in relationships where one person, the codependent, is excessively reliant or dependent on another person. In this paradigm, the other person is the enabler. In these types of relationships, the codependent individual is consistently relying on the enabler for their sense of self-worth, identity, value, and emotional well-being. While dependency can manifest itself in various ways, it invariably leads to unhealthy, unbalanced, and sometimes even toxic relationships. Most times, individuals that engage in codependent relationships display that pattern across the spectrum and are codependent in multiple relationships at the same time. So, here are 5 signs that you might be participating in a codependent relationship. Number 1, excessive caretaking. Everybody knows the fixer, the one that's first called for everything and anything, and no one can take care of something like they can. Codependents often prioritize the needs and wants, desires of others over their own needs, wants, and desires, often to the detriment of their own well-being. If you are always the one in the caretaking position, that may be a sign that you are engaging in a codependent pattern. Number 2, low self-esteem. Codependents often have poor self-image, low self-love, and minimal self-efficacy, as they may believe that their self-worth is tied to their ability to please or take care of others. Understanding that low self-esteem typically causes the person to look outside of themselves for affirmation and validation, the codependent relationship provides that for the individual, as the enabler tends to feel wanted or needed. Number 3, difficulty setting boundaries. Codependents may have trouble asserting themselves and setting healthy boundaries in their relationships. They may fear rejection or conflict and, as a result, tolerate mistreatment or compromise their own needs. If you have difficulty saying no, in addition to any of the other signs that were mentioned, please pay attention to that. And remember, when you're saying yes to one thing, you're also saying no to something else. Number 4, avoiding conflict. Codependents may go to great lengths to avoid conflict or disagreements in their relationships, often at their own expense. They often suppress or stuff down their own feelings, needs, wants, and desires to maintain harmony in the relationship. This is twofold because codependents may also have trouble identifying and expressing their own emotions as an individual. Since they're so used to being attuned to the emotions and energies of others, they struggle to identify and then communicate their own feelings. Last one, number 5, enabling behavior. In many cases, codependents engage in enabling behavior that allows the other person, often someone struggling with mental health issues or addiction, to continue their destructive behaviors without ever having to face consequences, which continues the cycle and makes it difficult to interrupt or stop without intervention. Understand that codependency is not the same as being interdependent because there is a clear one-sidedness to a codependent relationship. Interdependence requires both partners to give and take, that it requires mutual sacrifice and mutual submission. It's important to also note that codependency is not something you're going to find in the DSM-5. It's not an official diagnosis, but it is recognized in this field of psychology and therapy. Codependency can have negative impact on an individual's mental health, emotional well-being, and often it leads to dysfunctional and unsatisfying relationships. So what do? Therapy and counseling are common approaches to addressing codependency. These interventions can help individuals develop healthier boundaries, improve self-esteem, and learn to prioritize their own needs while maintaining healthy relationships with other people. So if you find yourself in such a relationship, please reach out for help. You deserve health and wholeness in your relationships. Lastly, while I am a licensed clinician, I may not be your licensed clinician. So, therefore, use this information to help clarify and identify any of these patterns. And please seek professional help if needed. Thanks.